Welcome to the autobiography of penicillinase-resistant antibiotics. My generic names are Nafcillin and Oxacillin. My brand names and chemical name Nafcil, Nalpen, and Oxal, Oxan. Now for my drug classifications. My therapeutic classification is antibiotic and my pharmacologic classification is penicillinase-resistant antibiotic. I belong to pregnancy risk category B, and for my mechanism of action, I interfere with the ability of susceptible bacteria to build their cell walls when they are dividing. Also, biosynthesizing the framework of the cell wall by the bacteria is prevented, and this leads bacteria with weakened cell walls swell and then burst from osmotic pressure within the cell, leading to cell death. Now, for my pharmacokinetics, I am rapidly absorbed from the GI tract and I reach my peak level within 1 hour. I am widely distributed in the body with adequate levels achieved in serum, tissues, bile, and synovial fluid. I undergo hepatic metabolism, and I am eliminated and almost completely unchanged in the urine. Now, for whom am I indicated to? I am indicated for the treatment of streptococcal infections such as pharyngitis, tonsillitis, scarlet fever, and endocarditis. Also for anthrax, syphilis, uncomplicated gonococcal infections, and at higher doses, I am also used for the treatment of meningococcal meningitis. Now for my contraindications. I am contraindicated to patients with allergies to penicillins and cephalosporins. Also, my use should be limited in pregnant and lactating patients. Now let us go to some effects that I may cause you. In the GI tract, there would be nausea, vomiting, abdominal pain, gastritis, sore mouth, furry tongue, glossitis, and stomatitis. I can also cause superinfections and yeast infections. Hypersensitivity reactions such as rash, fever, and wheezing might also be present. Now let us go to your nursing responsibilities. Before, assess the patient for known allergies to penicillins and cephalosporins. Assess for history of renal diseases that could interfere with excretion of the drug. Assess patient's current pregnancy or lactation status. Perform physical assessment to establish baseline data. Perform culture and sensitivity tests to ensure the right drug choice for the patient. During, ensure that the patient receives the full course of the penicillin as prescribed in doses around the clock to increase its effectiveness. Provide small, frequent meals as tolerated. Provide adequate fluids to replace fluids lost with diarrhea. And monitor for any signs of superinfections in the patient. Instruct patient regarding the appropriate dosage regimen and possible side effects to increase patient's knowledge about drug therapy and promote compliance. After, monitor patient's response to the drug. Monitor for the adverse effects of the drug to the patient. Monitor for the effectiveness of comfort and safety measures and compliance to the regimen of the patient. Thank you for watching.